ZUMA-24 was a multi-center clinical trial that was done in the United States, and the question the study wanted to answer was whether it was feasible to treat patients with CAR-T in the outpatient setting. The reason is because the first studies, ZUMA-1, was done in the inpatient setting. Patients stayed an average of 15 days in the hospital, but since then we've learned how to intervene early, we've learned how to use this axi-cel more, and then the question is whether we now have enough evidence and enough expertise to treat some patients in the outpatient setting. And one of the reasons why we wanted to do this, it is true that we can treat patients in the hospital, but they use a lot of days in the hospital, and we know that quality of life is better for somebody who does not sleep in the hospital. So patient comfort was an additional reason to want to see whether we can do some of this treatment in the outpatient setting. These were the findings of the study. We've enrolled 35 patients, of which 30 have already received the product. And what we were doing was to compare what happened in this study to the ZUMA-1 that was done in the inpatient setting. First of all, the rate of grade 3 or higher CRS was 0, whereas it was 13% in the ZUMA-1 study. The rate of grade 3 or higher ICANS was about 20%, whereas it was 27% in the original ZUMA-1 study. So that suggested that the toxicity profile was certainly not worse, maybe even better because of the close monitoring in the outpatient setting. We also found out that patients needed a less total hospital stay, which median was 8 days, whereas it was 15 days in ZUMA-1. Then looking at the response rate, okay, how well did the CAR-T work? We found out that the objective response rate was 90% and the complete response rate around 70%, which is at par with what we found in the ZUMA-1 study. So our finding so far is that yes, we can safely treat patients in the outpatient setting. They spend a lot less days in the hospital. Their toxicity is the same or maybe even better than it was in ZUMA-1, and the response rate was also as good or maybe even better than it was in ZUMA-1.